Hello future dentists, welcome back to Exam Key Point Dentistry. Today we are going to learn a very easy and important orthodontic topic, vestibular screen or oral screen. Now let me ask you one question. Have you ever seen children with habits like thumb sucking, mouth breathing, tongue thrusting or lip biting? And do you know these habits can actually change the alignment of the teeth? So today we will learn about the appliance that helps stop these habits in growing children. And trust me guys, after this video, Vestibular Screen will become super easy for the exam and Viva. So grab your notes and let's start. So, what is vestibular screen? So first of all, what is vestibular screen? This appliance was introduced by the Newell in 1912. It is a simple functional appliance that takes the form of the curved shield of acrylic which is placed in the labial vestibuli. So in this image you can see this is a curved part which is stay in front of the teeth inside the lips and the ring which is help in holding and removing the appliance easily. Okay, so now student, this is important for the exam, that is a principle. So the vestibular screen works on two principles. So first one is force application. So it works on the principle of the both force application as well as force elimination. So there are the two principles on which the vestibular screen work. Okay, so here the force application means it applies the gentle force on the teeth and the muscles, and while force elimination here means it removes the abnormal muscular pressure from the lips and the teeth. So question for you, which abnormal habit create unwanted force on teeth? The answer is thumb sucking, tongue thrusting and lip biting. Okay. Now let's discuss the indication. So the vestibular screen is mostly used to intercept the mouth breathing habit. So easy understanding is when a child breathes through the mouth continuously, the lips remain open and facial growth can affecting. So this appliance help train the children to keep the lips closed. Okay, so other indication is they can also be used for the interruption of habit like a thumb sucking, tongue thrusting, lip biting and cheek biting. So it can also help in mild distal occlusion, can also be treated using the vestibular screen. It also help in correction of the hypertonic lip, that is a weak lip and the cheek muscles. It also used to correct the mild anterior procrustation. Okay, so in the left image you can see this is a protrudated upper teeth. This means because of the abnormal habit and the muscles imbalance. And then in the right image the child is sucking the thumb during the sleep. So this is a classic habit indication for the vestibular screen therapy. Okay, student, now learn how this appliance is made. So step 1 is impression. So here the upper and the lower impression are they taken. Step 2, that is a working model. The working cast are the poured. Step 3, the cast should reproduce the full depth of the vestibular sulcus. Okay, so why this is important? Because the appliance should fit properly inside the vestibule. Step 4, the upper and the lower cast are occluded in the normal intercuspation and sealed with a plaster. Okay, so the first two images show upper and the lower dental cast, and the third image show both the casts joined together in the normal bipilation, and this help in accurate appliance fabrication. Okay, now very important design point. So here the vestibular screen should extend into the sulcus to the point where the mucosal tissue reflects the outward. But care should be taken not to the impinge on the frenum and the muscles attachment. Otherwise, the patient will feel pain and irritation. Okay. Now, posterior extension. Here, the appliance should extend up to the distal margin of the last erupted molar. Okay. So, in the clinical image, that is noticed the appliance covering the front vestibular area. That is this. Here it will be covering this front area. This all cover the front. It should all cover this area. So in this cast image show the wire adaptation and the extension of the appliance, that is up to the last erupted molar. It should be extended. Okay. Now, next step is the models are covered with 2 to 3 mm of the wax over the labial surface of the teeth and then alveolar process. So this creates space inside the appliance. Okay. Now then the appliance is fabricated using the self-cure or heat-cure acrylic resin. Finally, the appliance is smooth using the sandpaper and polish. So in the image, you can see this is a transparent white vestibular screen which is placed in the mouth, and notice how it sits in front of the upper and the lower teeth. So it acts like a barrier between the lips and the teeth. Okay. Now coming under the management of the appliance, so now comes the patient instruction. So here the patient should wear the appliance at the night and 2 to 3 hours during the daytime. Also the patient should maintain a proper lip seal. Okay. So why is lip seal important? Because it trains the normal muscle function and helps stop mouth breathing. Okay. Now the modification of the vestibular screen. So here modification is Hotz modification. So here the oral skin can be fabricated with a metal ring projecting between the upper and the lower jaw. Here the tongue thrusting patient. So in patient who have tongue thrusting habit, an additional screen is placed on the lingual side of the teeth. Okay, and this screen is attached with the vestibular screen by means of a thick wire which is passing through the lateral incisor region. So this helps prevent the forward tongue movement. Okay, so in this figure you can see if this is a vestibular shield and a metal ring which is in the center, and this is a modification of the oral screen design. So here you see this is a screen which is attached with the thick wire here which is passing through the lateral incisor. So this is a lateral incisor. Okay, so this helps to prevent the forward tongue movement. Okay. So before ending the video, let's revise quickly. So it was introduced by the Newell 1912, functional appliance, and it is used for the mouth breathing and the oral habit. Work by the force application and the force elimination, made using the acrylic resin, worn at night plus daytime, and modification is Hotz appliance. Okay, so guys, this was a complete easy explanation of the vestibular screen or the oral screen. If this video helped you understand the topic, then like the video, share with your BDS friend, and subscribe to Exam Keeper Dentistry. See you in the next video. Bye, future dentists.